Doc, Major Womo looking at commentaries, if free Abaimu, Abasisia, Mene Jefferson, Ekase, there's a commentaries in the crowd, and the crowd say a contributing factor. Yanti Amanes for an affair, Oma Chuncha inside Mano, one more Yakra. Well, an apology sort of from the minister suffice. Minister, no, on Pacho, Mitchell Health Minister.
Yeah, also Pacho. The discussion we echoes here, me who know TV station, yeah, I'm person of good. Now, will be to her cafe. And when the host even brought up the point to say, we never say, we need the HN say, we are nurse, now we are midwife, we are doctor, we call hospital. Now, Nyame and partners be aware, pick up infection, be now we call hospital now. Treatment costs, you know, the health insurance, and me and Pekia, one casa or two bottom, now would their Kutiaka. Well, now obiti TV station a cafe. The fact to say we are Jima or hospital now, I reform in Chile, we are rare. But my goodness, look at this, and the employer himself. No, the thinking of the employer himself is in line with this, and that is why they are denying nurses and midwives of what is rightfully due them. Yes, to answer your question directly, the minister should come and apologize to the nurses and say, what you are doing. He can even come up with a solution via a say, I'm offering at this time half or 3/4 of what you are asking for. Now, my promise is say, later on, as you go on, the mama. The Bisha Krabeto, Lens Amedo, the second Lens Amedo, Akmasu, Amawamba. The British Abria on Kafina, Timidin, Woodiness, and excessive, almost restricted, awareness than saying, oh, medical people who constitute 60% of the health sector workforce. You see, more responsibility is given to them, and they are prepared to deliver what they are supposed to deliver. They are working on a very tight rope in delivering service across the country. Look at the next midwives, Omuni who are health sector in breaking down. Sisi Akra, when you are echo. And to say if what the people are saying is for EU and for conditions of the hospital airways now. We blame the Minister of Health for this. And if people are dying, it is the minister who is killing them. It is unfortunate. And so he should rethink his decision and sort out the nurses.
Doc, I mean, now, Sina, Yemfa, and Komono, and Siha. Yeah, that's a power. Dr. Kwaku Asante-Krobea, a former president, Ghana Registered Nurses and Midwives Association, and